Hello, Anthea. How are you?
I'm well, Jacqueline. Nice to see you.
Nice to see you too. I really wanted to have you to come and chat because I think you've got some really beautiful insights to share with women that are even planning for a pregnancy. I still think it's really important to start thinking about this now, but especially for women that are pregnant and who are planning for their birth, because I know that you are the VP of the HypnoBirthing Institute, and you take care of HypnoBirthing International for us here within Australia as well. And so I think that you're going to have some really unique insights. So thank you for joining me.
Oh, thank you for having me. It's
So
exciting.
So tell me how, like, because I know the work that you do, but obviously other people might not. So tell me, how did you get started with your work with hypnobirthing?
Well, my story is quite been quite a personal journey as to how I got involved in hypnobirthing, and really, and today I do want to talk a bit about fear, because of what's going on for everybody. But really, my whole journey here to hypnobirthing came from my own fear. And so I'll tell you a little bit about that. So 22 years ago, we fell pregnant with our first child, and I actually already had a really big fear of childbirth. I thought that, and I think that was just the messages that I'd been given as a child, and had grown up with. I do remember somebody at school saying to me that childbirth was as painful as a shark bite or something, and I remember thinking, far out, that sounds pretty painful. And so I already had this great fear. So when I fell pregnant, even though we were excited, I definitely, my fear levels were pretty high. And we went off and did our antenatal classes, and they showed a horrific birth video. And I remember looking at my husband and thinking, oh my gosh, I don't know how I'm going to do this. So I had all of these ideas about birth that so many women do, traumatic, difficult, painful, all of that, dangerous. And when it came time to going into spontaneous labour, I did. And actually, the labour wasn't too bad to start off with. And then very, very sadly, I had a placental abruption, and we ended up losing our little girl in birth.
Oh, no.
Yeah, so that was just absolutely devastating for my husband and I. But I suppose, it had, apart from the devastation, it just confirmed everything that I believed about birth, that it was dangerous and, and all the rest. So, but with empty arms, we, desperately wanted to have a child. And so about 8 months later, we fell pregnant again. But because there was no time during that, because I'd gone full term, there was no time during that pregnancy that I sort of felt safe. My fear levels were through the roof. And I allowed our doctor to induce us about 3 weeks early. And so my body wasn't ready. And, because I was so fearful, I was like, whatever it takes to get this baby out, and ended up having a very intervened birth and ended up in an emergency cesarean. So whilst we had this beautiful little girl, Matilda, in our arms, I was quite traumatized from that experience. And then, it was many years, it was 5 years before we even thought about falling pregnant again, just because I think I had that trauma definitely, carried with me in so many ways. I think even just with my confidence and as a mother, but just, in every part of myself, it was, it had infiltrated. And so then we fell pregnant again, and I knew that I needed to do something to really help me get through that. And a girlfriend of mine said to me, oh, you should do hypnobirthing. And I was like, oh, that sounds a bit hippie to me. I'm not sure.
So when was this? How long ago was this?
So Jack now is, he'll be 15 this year.
Yeah.
So quite a few years ago now. But also because I'd had that emergency cesarean, I really wanted to have a natural birth. But, 15 years ago, VBACs were not very well supported either. So I went to an obstetrician and said to him, this is what I want to do, and I want to have a VBAC. And he was like, oh, I don't know whether we're going to be able to achieve that. But then, and so hypnobirthing, girlfriend said, what about hypnobirthing? And there was really nothing else offering itself to me. And we went, oh, what the hell? We'll give this hypnobirthing a go, even though I was highly skeptical and I didn't really feel that comfortable because of the word hypno about doing it. But, we had this educator come and spend, the 5 sessions with us, and it just completely changed my pregnancy and my confidence in that pregnancy. And it completely changed my birth. We just had the most healing, beautiful, empowering birth with Jack, and it completely changed my life, Jacqueline. It was just, I think, the skills and the tools that we learnt, they're life skills. They're not just skills for birth. So, by the time I did give birth, and I went nearly 2 weeks over with Jack, which just amazed me, and even my obstetrician, that, I could sort of had the confidence to do that. I was like, bring it on. I was so excited about this birth. And yeah, so it was just amazing. And it was not only so, beautiful for me, but also for my husband, because in the 2 previous births, he was very traumatized as well, but also he wasn't at all prepared, to how to support me. And so, I suppose that was really disappointing as well, just that he didn't know how to sort of connect with me in labour and that sort of thing. So this was just such a completely different story, and he was, he had all the tools and he was just so on board. So yeah, it was just such an amazing experience. But I suppose once I'd had that birth, as a woman and as a mother and as a wife, and so many areas of my life, I, really changed with my confidence. And but I'd been in the corporate sector as well, so I did go back to work, but I was like, oh my golly, I don't want to be doing this anymore. And I decided that, I would go and train to be a hypnobirthing educator, because I knew that if I could go from that complete debilitating fear with, even from our birth with our little girl Mackenzie that we lost, to, going to Jack's birth, to like bring it on. I was so excited and could have that complete transformation. I knew that, hypnobirthing could have such an impact on so many people.
And I guess also feeling yourself move and seeing whatever you and your husband move through those 3 really different births and the transformation of that. It's hard not to want to share that, isn't it?
Oh,
don't
absolutely.
You think? Like, that it's possible. So it's kind of, it's like
totally.
like obvious, like, oh, how could I not share this with other people too?
Absolutely. And, like I still get to work with parents, not as many as I used to, obviously now, but I really, I still absolutely love working with couples, because just seeing that transformation that they do go through is just, it's just so rewarding. It's amazing.
Yeah, absolutely.
So I went and did my training with Marilyn Boone, who was the faculty member before me here in Australia, and was just, so I was just so excited. And then I went on and did my clinical hypnotherapy and
okay.
Yeah, my fertility. So did quite a bit of work in that field, which I'm really passionate about as well, which I know is an area that you're working in. And also just, I suppose I'm passionate about the personal and professional development of, educators, but everybody that I work with, because I know now just how, how incredible our minds are, and through, working with your mindset, how you can really transform your whole life,
any experience, right?
Absolutely. Yeah.
So you trained and started teaching when? How long? Have you been
So I've been an educator for 13 years,
Yeah,
and
okay.
I became faculty, I think it was 6 years ago.
Okay. So let
And
me ask this
yeah,
question then. Have you, in that 13 years, have you seen things change really a lot, or are you seeing very consistent sort of things in the birthing world today? And then also right now, like with the pandemic and the changes
yeah.
in hospital policy?
Yeah, look, I've definitely seen a change in the 13 years, without a doubt.
Mhm.
And I think, there are so many amazing birth professionals, midwives, childbirth educators, OBs and doctors. There's so many people out there championing for, more positive births,
Mhm.
that I think, there is a much greater awareness. And I think social media has played a really big role in that as well. It also has the negative side to it. But I think parents are, much more aware of, advocating for themselves. And so I think that has made a change in itself.
Mm.
And so I've definitely seen a change in policies and that sort of thing. But we're still a long way from where we really should be. I mean, Australia has some of the highest intervention rates in the world. And
Mhm.
I think still a lot of Australians don't realise that. They see this incredible medical system, which we do have, there's no doubt about it. And thank God we do have it, because, obviously we need it there to, in a medical
When it's neat, yeah. Yeah.
instance, absolutely. And to save, mothers and babies if there's a medical need. But unfortunately, you know, there are so many times, and you would see this yourself with couples that you work with, that there are so many, so much intervention, and that really is unnecessary.
Mhm.
And I think that's where we still need to do a lot of work in. It is
Mhm.
really educating families, and that's why I'm so passionate about what I'm doing. Not only because of that fear, and how I know that it can really transform, somebody's pregnancy and birth and life, but also just really that importance of educating and just teaching parents about informed choice, and their rights,
Mhm.
really. And
And understanding what questions to even ask so that you can figure
absolutely,
out whether
absolutely.
something is really necessary or
And
not.
that's right, because to make an informed choice, you need to be able to, have questions to ask, and just know that, informed choice is, it's a human right.
Mhm.
It's
Mhm.
one of our human rights to be able to do that.
Mhm.
I think a lot of parents sort of go into this experience being led along this, train ride, basically, where not understanding that they can make those decisions and work really positively and collaboratively with their
Absolutely.
care provider.
Absolutely agree with that. Yeah, absolutely agree. And any questioning and asking, any recommendations that are given to you, genuine, healthy inquiry as to why that's recommended. I feel like a lot of
Yeah,
people don't even know that it's okay to do that. Like some people genuinely feel uncomfortable that they could bring up and ask why that would be done. And it's great to if you both decide together that's exactly the path you want to go down with the care provider, that's
yeah,
brilliant. But yeah, just some
absolutely.
people don't even know it's perfectly okay to ask the questions to feel comfortable with what you're actually
Yeah.
doing.
And I think, Jacqueline, that's really important right now as well, with,
Hmm.
what is going on, because I think parents do need to really ask a lot of questions at the moment, so that they can make the best decisions for themselves going forward.
Yep.
I mean, we have just been inundated with calls and emails from, pregnant couples that are just so frightened. It's honestly, it's really saddened me just to see the effect that this pandemic has had on so many pregnant couples.
What do you think that are their biggest fears around changes in the hospitals at the moment, or because they can't go to their antenatal classes at the hospital? Like what are some of the really
Yeah,
common
I
fears
mean,
that you're hearing about?
absolutely, that has been taken away. Look, I think, fear is obviously at the forefront of this, and I want to talk about fear, but I think, I mean, obviously fear of the virus is out there, but there's some really good evidence, and I think parents that, pregnant couples should see the evidence so that they do feel more confident with moving forward. And Evidence-Based Birth have some great free videos on their website at the moment about evidence, and what it's showing is that there is no evidence that pregnant people are at greater risk of infection or severe illness with this coronavirus. It's not found, in amniotic fluid and in the cord blood and or breast milk. It doesn't seem to be transferring vertically, which is, from mum to baby in the womb. I think there was one case of vertical transmission and it still hasn't been confirmed. So I think it's important that parents are informed on the evidence on it, so not to get, overly carried away with being frightened about that as well. So I think that's one thing, but I think the media have really, really played a big part in everybody's fear. So I'll talk about that in a minute, just in regards to, I think, some strategies to deal with that.
Absolutely.
But I think that new model of care, like you said, I'm working closely with our hospitals because we've got the program in 8 hospitals here in Australia. So we've been moving all of not only the educators classes, but also the hospital classes over to the online format. So I've become pretty familiar with what's going on in the hospitals, and I do understand where the fear is coming from. So, what's that looking like now for parents? I mean, obviously, and you would have seen a lot of this or heard a lot of this, antenatal appointments and screenings and that sort of thing are being reduced, and mums can only go in by themselves. One support person in the birth, and I know that is not consistent all around the world, but here in Australia that is. And then only sort of, I think that the birth partner or husband or whoever it is asked to leave within a couple of hours, and they can only visit for a couple of hours a day. No other visitors at the hospital. Inductions seem to be being recommended much more, even prior or around 41 weeks, which when you look at
is there any reason why they're suggesting that, or is just a trend that you're seeing?
It's a trend that I'm seeing, but it does concern me because I was looking into what the World Health Organization and RANZCOG and everyone have said, and I mean the World Health Organization have said that the mode of birth should still be individualized, based on indications and women's preferences, that cesarean should only be used when medically justified, and inductions should be based on those normal guidelines. But that's not what we're seeing. Even they're still recommending skin to skin and breastfeeding in that first hour. Obviously, and the recommendations do differ. I mean, if you look over at the World Health Organization compared to the CDC and our RANZCOG and UK, there are some differences. But even if you had coronavirus or had suspected, they are recommending continuous monitoring, and but again, mode of birth and inductions individualised. They're not recommending water births, but I'm seeing a lot of hospitals here in Australia that are saying no water births for women that aren't suspected of having the virus.
Yeah, I've heard of that too.
So it doesn't seem to be evidence-based, which is disappointing. Epidurals, gas and air, they say are okay, yet epidurals are happening, but gas and air is often not, being told it's not offered when, the researchers come out to say that it is okay. And they're saying that even with somebody that does have coronavirus, delayed cord clamping and skin to skin with a mask, and even breastfeeding with a mask is okay, and still, rooming in and staying with baby. So yeah, I think the information is different. It's certainly not consistent. But I think, there definitely seem to be, more interventions and water birth being taken away, and early discharge from hospital, which
really changes the way people have projected their pregnancy and birth to look, doesn't it? So it really is different. For all of a sudden, there is a shift in the way they're having to make decisions and act in and around that birth. So what do you think are some really useful things that women should be doing? I mean, you've mentioned the fear, and because I'm a hypnobirthing educator as well, so I understand where you're coming from with that, because fear is such an important part of, eliminating fear and working a way around. It's such an important part of birth, full stop, actually life, isn't it? Really, it's not even just birth.
Absolutely, yeah.
But what are some strategies that you think are really important for women right now? And I know HypnoBirthing International is kind of almost really leading the way in helping with online education right now. So can you touch on all of that for me, so we can make sure people actually know some things to work with?
Yeah, so let's talk about some tips first, and what you said is so right, is that reducing fear is really important for even for fertility, pregnancy, birth, and in life, but particularly in birth, which is I suppose what we're talking about right now in regard to tips that people can be using, is that when we are in that fear state, we go into that fight and flight, and blood gets redirected away from the uterine muscles, and that can cause a lot of discomfort and can slow or shut labour down. So keeping beautifully relaxed is really important to get lots of oxygen to those muscles, and also looking at that whole hormonal flow as well, because when we are in that fight and flight, we've got adrenaline and cortisol running through our system, rather than when we're beautifully relaxed and calm. We've got endorphins and oxytocin, all of these incredible hormones that are there to facilitate a physiological or instinctive birth. So let's have a look at some tips. And I think I do want to point out that, I mean, but no matter whether we're in a pandemic or whatever, birth is unpredictable. And it's intense and it's powerful, and add a pandemic into the mix and it can be very, very daunting, and that's obviously what we're seeing. But I think that on the flip side of that, birth still can be incredibly empowering, and I mean, it can completely transform a couple. I mean, it did for me, it did for us. So with your whole sense of self and confidence going forward. So even,
and I can relate to that too. So it's not just anyone else is watching as well. It's your experience. It's probably how a lot of us that ended up teaching hypnobirthing kind of got there, was because it was a transformative experience in our own
absolutely
lives. So I vouch for that completely as well.
Yeah, definitely. And that's why like we've got, I think it's over half of our educator base are midwives, but I think the rest are really mostly mums that have done the program and end up just going, oh my gosh, like me, I really want to share this. It's just so incredible. So some of the things we can be thinking about are, obviously following the guidelines, like washing hands and limiting social contact and all of that goes without saying. I think one of the big things is, particularly for pregnant women, but for everybody, is switch that media off, because particularly in those latter stages of pregnancy as well. I mean, it's such a incredible hormonal system, pregnancy and birth, and with all of this, not only with the fear but also with this too much stimulation, as we start to affect some of those incredible hormones that release for birth. So really taking yourself away, even without a pandemic, is really important in those latter stages of pregnancy anyway.
To go inward with what's really happening inside.
Absolutely, and allowing those hormones to release as they should. So just making sure that you can keep up to date with what's going on, but don't spend all your time sitting there reading what's going on, because there's so much hype as well from the media, which can really, really freak everybody out.
Yeah, absolutely. And even just the way it's presented, it's designed to stimulate us. So, I think realistically, if someone wants to spend, even 10 minutes in the morning and 10 minutes in the afternoon, really, if they really want to know what's happening, I think there's a lot of really good places you can find information. 20 minutes a day can keep you up to date with that kind of stuff.
Yeah, absolutely. And, just on a side note to that, I think I mean, I see as well, I know for myself, I'm obviously still working, but I'm actually really enjoying this time
Oh, yeah.
to connect with my family and just be here. And, so I think if we can, there's always an opportunity to look at the, and, I said this recently at a webinar that I did with the educators, just look at always flip it and look at the opportunities and the possibilities. And there are so many,
I agree completely.
yeah, and I think so many for pregnant couples to be able to spend that time going within, connecting with baby, and, just together, and all of that special bonding time. So there are positives in it as well. So
I think there'll be beautiful memories for people even a year down the track when they're holding their little babies, thinking about even the couple of weeks before their birth when they were just at home with their loved one and imagining what life was going to be like soon when their baby was born, and not being influenced by all the stuff, going out and doing all the stuff with other people, just remembering what it was like, just the two of them. I think that's going to be really special memories for people.
Yeah, definitely. I think a big one is, choosing your care providers and your support really carefully. Being able to have a good discussion with them and a lengthy discussion, not just a 10-minute appointment, but looking at what your options are, and are they following that best evidence even in a pandemic. So I think that's really important. And are they, do they know what you want? Are they going to support you and advocate for you with that? So I think that's really key. I think also we need to get really creative as well in this time. So, I talked about only one support person. So, if that support team was going to be a doula and a photographer, and they can still support you at home, and then even,
You mean before you go to the hospital, right?
Yeah, absolutely. Coming home and giving you that support, and staying at home as long as possible, which is highly recommended at the moment. Anyway, always, but but especially at the moment. So, and even with the appointments is, if you can only go to those screenings or the appointments by yourself, take FaceTime if you've got it, and, put hubby or, your partner or your birth partner, take them in with you, but on FaceTime. So I think we can get creative and still have that.
Definitely. And I think there still can be that second set of ears, at an appointment when two people can hear different information, even though the exact same thing gets said, we just both pick up different things. So still to have a second person listening, I think can really, is really important.
Yeah. Understanding informed consent, and the fact that is just, as I said, a basic human right, even during a pandemic, and just getting educated on that so that you and your partner can really advocate appropriately, during pregnancy and birth, and you can make the best decisions alongside with your care providers.
Yeah, to feel like, to know you've been a part of every decision.
Absolutely, and lead that birth in the most optimal way. Getting tools to, reduce fear and stress and anxiety is absolutely key. So, daily relaxations, affirmations, and, really focusing on the positive and what it is that you want. And we very much, we cover this in the program, and with lots of tools, and, but it absolutely is so key. And I know you're going to put a link in there, but I've put together this free, beautiful guided relaxations for pregnancy that we're giving away. So if you can put that,
I can put a link in that for sure.
That'd be so lovely. And what I've done is some automated emails that go out with that link to lots of different blogs on the website that are really appropriate for our parents now. So, even if you can't get out and or do antenatal education, if it's not within your reach at the moment, then just even absorbing all of this information is going to be really, really helpful.
Powerful.
Yeah. Staying at home as long as possible in regard to once you do go into labour is obviously, important. So, and I think, having those tools as well, and techniques, to keep calm and really embrace, those powerful surges, and really connect with your baby, and just surrender to that, that beautiful intensity of birth, So we do need tools to be able to do that. I think that's, that.
And not just for us as the women or person birthing the baby, but also, like you mentioned very early on when you're talking about your own story, it's also for the birthing partner, the birthing companion, to feel confident to be at home as well, right? So they know, understand what's happening, and confident to support the birthing person rather than just feeling like they don't know what is going on, right?
Yeah, absolutely. And then, I mean, another option as well is even birthing at home. And I mean, I think, you've got to be realistic as well, and depending on how far along you are and whether or not, because I know that there has been a huge amount of women reaching out to home birth midwives, and, obviously to have a home birth, home birth is very safe when you're with a midwife that works with home birth, and you have that continuity of care. I mean, continuity of care, that model of continuity of care, I mean, research shows it is the best model for optimal outcomes for birth. So I think, unfortunately, the messages around home birth, I know here in Australia, have been quite negative from a lot of, the medical, lots of, different areas of medicine have sort of poo-pooed it. But the evidence shows that it is very safe when it's done, with that care. So that is a great option. And obviously with working with those midwives as well, if there was any indication that, birth was taking a turn, then you would be transferred to the hospital anyway. So that's,
they'll practice within their own scope.
Absolutely. So I think another big thing is really avoiding inductions. Even though I can see that seems to be a bit of a trend that's rising at the moment, that widespread of introduction of induction carries, a risk, like long-term consequences. And, some of those consequences, I think, still unknown, because we don't have enough studies on inductions yet, unfortunately. But I think it's important that people understand that there was a study done. It was a large population cohort study of, I think there was like 500,000 Australian mums and babies in 2018, which it basically was showing that, rupturing your membranes and for low risk women having inductions, because I think, the message is sort of let's release those membranes, it'll make labour go quicker, but there's no evidence to show that, rupturing the membranes is going to reduce the length of labour. And so, it's not evidence-based to just jump into an induction. And I think what a lot of women and couples aren't aware of is that cascade of intervention, that once you do start something, you're more likely to end up needing something else. And I think that's one of the big keys here now, because if we want to avoid and stay away from hospitals as long as possible, then having the most physiological and instinctive birth that we can is going to be, the best outcome.
And even for people that are going to the hospital birthing, it also means then that they're likely to be able to be included in the possibility of being discharged early. So actually only being there for a very short space
because, if we end up with a cesarean and for some people, cesarean is something that is needed, or, their most positive, thing that they see. And we're certainly not anti-cesareans, but I do think it's something to very much consider, particularly in this time of what's going on, and because you are going to be in hospital much longer. So I think, this is going to give you the best chance of having that physiological birth and getting back home as quickly as possible. So
that's beautiful. That's a really extensive list. Thank you for going through all that with me.
My pleasure.
So I need to put a link in for the pregnancy for the download for that guided relaxation. I know that a lot of educators are taking their HypnoBirthing courses online, so I'll put a link up for that.
Absolutely. And I think, in terms of that list of tips, I think probably, one of the big ones that I haven't mentioned is getting educated, because hospital classes have been taken away, and some hospitals are sort of getting it together and getting online in terms of with just traditional antenatal. But I think for so many parents that option's been taken away. But
and I think that's also within hospitals, because also staff are being deployed to cover other units and that kind of stuff. So it's not that they're just like just not putting it together. It's that people are also
well, I
in other
think
areas.
it just hasn't been set up that way, and it takes a while to get something like that set up. So so we do have the program online, and look, I want to say this, that I mean, I'm obviously biased because I did hypnobirthing. It had such an impact on me, and I'm passionate about hypnobirthing, and I want obviously the parents to soak up hypnobirthing, use all the tools and techniques. But there are lots of there are other really great programs out there. Like, we're not the only ones doing amazing work in this field, and there are some really great programs out there. I mean, Lamar's and Calm Birth are doing great work as well. So I think the key is get educated, and there are options out there. We would love to to support you, and we've got nearly 200 educators here in Australia, and ready, and we've got all of our online classes up on the website now. More, we're putting more and more up all the time. So there are options out there, and I think it's so key to.
I think I mean, I do know this rationally, but also I think if I can bring it back to something that you've mentioned, because we mentioned fear was such a big piece of this, or eliminating that's an important part of having a really, positive birth outcome. But also, when you are more aware, when you are more educated, and when you're more informed, yes, you can work on the fear and eliminate from an emotional perspective, but just mentally, when we actually understand what's happening and what our body's going to be doing, and even those last few weeks of pregnancy, what that looks like, or when birth first starts getting started, or getting that education, getting information actually just helps eliminate fear anyway, because you understand more.
Totally. And I think, just you know this, Jack, just seeing those couples go through the 5 sessions, and, I talked about that transformation, but going from that fear and then becoming really educated, and just seeing that, their shoulders drop and that fear start to drop away with, even with, I mean, obviously we've got breathing and visualization and, hypnosis and, deep relaxation and all of that. But I think just absorbing all of that information really helps to reduce that fear anyway.
Even regardless of any hypnosis or techniques or anything like that to eliminate the fear, I really firmly believe that getting educated is one of the really powerful ways to do that.
Yeah, absolutely.
So before we finish up, is there anything else on your list that you wanted to go over? Anything else you wanted to share with people that are preparing for birth right now?
Look, I think I think what's really key is, as I said, is about fear. So I talk a lot about emptying the cup and filling that cup up again, emptying the cup of all of the negative and all of those things. So, all of those things I spoke about media and, all of those things that you're fearful about, is get rid of them. And, we've got great tools to be able to help you do that. And that's what you will learn in the program. And then filling that cup up with absolute goodness. So, watching positive birth videos and getting yourself educated and all of that, that is just so key. So, so we've got the beautiful free guided relaxation download that you'll put a link to. Yeah. And on our homepage at hypnobirthinginternational.com.au, there's some tabs on there. So, I've got a tab on there for hospital classes. So if if your hospital classes have stopped, then you can jump on there and put your details in, and we'll give you. We're still recommending, even though our classes are online, is working with a local educator, because they're better able to support you in the policies and everything that's going on in your local
What's happening in your area.
Yeah, absolutely. So I do recommend staying with an educator in your area. But we also run these really great 1.5 hour free information sessions, which is talks about hypnobirthing, but we also give away like our 5 top tips for having the most amazing gentle birth that you can have. So they're also a really great thing, I think, for parents to.
I can put a link for that too, actually. Because
Yeah,
again, that's just more information, right? And it is,
absolutely.
and like in
Yeah.
life, we are who we surround ourselves with, and even with the way we look at birth, it's what we surround ourselves with, isn't it? So the
Oh,
information
totally.
and what we put in and around our minds around birth is how we perceive it. So
Absolutely.
yeah, even jumping into one of those is a great idea. And like you said, that's completely free too, isn't it? So that's just more
Oh,
information.
absolutely. Yeah.
Yeah.
No obligation. It's just about sitting in there for an hour and a half and filling your cup.
Yeah, that's a great
I,
idea.
yeah.
Brilliant idea.
Yeah.
Thank you so much for joining me
Oh,
today.
my
Once I
pleasure.
upload this, if there's any comments, I might tag you in them or let them know so that we can just make sure that we get questions answered for people as well. But
Absolutely.
I'm
And if
very
I don't
grateful.
answer straight away, it's
Oh,
just but I will answer. I'll
that's
jump on and
fine.
have a look. But I'm
Completely.
trying to avoid too
Yeah,
much
completely.
social media if
Yeah.
I can.
Within your own time frame, it's totally fine. But thank you. I'm very grateful for you going. I think more than ever, it's a really important time for women to feel like they've got options, they've got choices, there's things that they can do. It's not
And
that
that they're
just where,
supported,
yeah,
and
yeah,
that's the thing, is there are so many birth professionals here around Australia just, ready and willing to support our couples. So, just you don't have to do this alone.
yeah,
And, I know with our educators that everyone's just so well connected to other, all other
resources.
areas that
Yeah,
support birth. So you don't have to do this alone. And with that support, we will help you move through this in the most positive way.
yeah.
For
That's
you.
beautiful. I think that's a really key message with lots of people that I'm speaking with. It's that even though people might feel like they are alone because they're further away from other people, that kind of stuff at the moment, but we're really not. Like, there's really a lot of ways to stay connected and be
Yeah,
supported throughout it all, even though it might look a little different from what they had originally imagined it to. So thank you, Anthea.
absolutely. Oh, my pleasure.
Thank
Thanks
you for
so
your
much for
time.
having me on. My pleasure,
Thank
Jack.
you. See you.